and hematinics. Now I am starting my new topic, that is poison and antidote. So in inorganic chemistry, as we discussed already, different inorganic agents related to expectorants, emetic, hematinics. So now poison and antidotes include some specific agents, that is sodium nitrite, sodium thiosulfate, activated charcoal. So, so what is poison? So firstly, we start with the poison. Poison is defined as a substance which, when administered, inhaled, or swallowed, is capable of acting deleteriously on the body, produce ill health or death. So all substances, according to Paracelsus, that all substances are poisonous. There is none which is not poison. So poison, what is poison? Actually, those substances which we inhaled in our body or they accidentally entered in our body, that produce different type of deleterious effect, and they can uh, produce ill health or death. So poison may be synthetic, mineral, vegetable, or animal origin. So there are different type of poisonous substance available in nature, and they may be synthetic, they may be mineral origin, or they may be vegetable or animal origin. WHO estimates over 30 lakh poisoning cases with 2 lakh 20,000 deaths per year worldwide. So that is the data that available on WHO website. How poisons enter into the body? So there are various ways through which poison enter into our body, through inhalation, ingestion, absorption, and through injection. So classification of poison. So poison can be classified based on type of action exerted or based on medical legal purposes. So they are basically classified on the basis of type of action and their medico-logical purposes. So the classification based on action can be classified in further six categories. First include corrosive, second irritants, third neurotoxic, fourth cardiac poison, fifth respiratory poison, and miscellaneous. So classification based on medico-legal purposes that include suicidal, homicidal, accidental, stupefying, that dose-related adverse effect, abortifacient, chiefly of drug causing abortion. So abortifacient is also a medico-logical purpose. Poison, cattle poison, then arrow poison, poison arrowheads, food poisoning, and drug dependence. So these all included under classification based on medico-logical purpose. So I have classified poison firstly on the basis of their action, and secondly on the basis of their medico-legal purpose. So first we start with corrosion. So what is corrosion and how it affect to our body? So corrosions are material that can attack and chemically destroy exposed body tissues. So they are further divided into acids. So acids may be inorganic, organic, and vegetable in nature. Inorganic acids include sulfuric acid, hydrogen chloride, and nitric acid. Organic acid include acetic acid, salicylic acid, oxalic acid, and carbolic acid. So these includes under organic acids. And some vegetables are also corrosive in nature, that include hydrocyanic acid and potassium cyanide. So these included under vegetable groups. Further, corrosion divided into alkali. So these alkali may be in hydroxides and carbonates form. So hydroxides may be of sodium, potassium, or ammonium. And in similar way, carbonates may be sodium carbonate, potassium carbonate, and ammonium carbonate. So the corrosives divided in two categories, acid and alkali. So acid include inorganic, organic, and vegetables, and alkali include hydroxide and carbonates of sodium. Further, poison may be irritants. So irritants basically are the substance that may cause injuries to the skin, eye, or airways after a single exposure. So irritants generally expose on the outer surface, that may be skin, eye, or any exposed surface that remain in the contact of air. So irritants further divided into inorganic, organic, and mechanical way. So inorganic irritants include non-metals like phosphorus, boron, fluorine, chlorine, bromine. So these non-metal inorganics may be irritates or exposed surface, and metals like arsenic, lead, mercury, iron, and zinc. So these are non-metals and metallic inorganic irritants. Further, organic irritants may be vegetables and animals. So vegetables irritants include castor oil, croton oil, and seed calotropis, ergot, capsicum. And animal irritants include snakes, scorpion, spider, and poisonous insect. So these all are included under animal irritants. So organic elements, as I told, that they divided into two categories. First is vegetables and second animals. And further, third is mechanical irritants. So mechanical irritants may be powdered gas, diamond rust, hairpin, needles, nail. So these all are included under mechanical irritants. So as I discussed, that irritants divided into three categories: inorganic, organic, and mechanical. Now come to neurotoxins. So neurotoxins may also be a poisonous substance, and neurotoxin generally called the substance that alter the structure or function of the nervous system. So whenever these neurotoxin entered into our body, then it may alter the function of the nervous system. So neurotoxin divided into cerebral neurotoxins. So cerebral part, when neurotoxin entered into the cerebral part, so they may be narcotic or somniferous family. So narcotic or somniferous family include opium and its alkaloids like morphine, codeine, theven, noscapine, and narcine. So these all are included under narcotic cerebral neurotoxins. Further, the cerebral neurotoxins categorize into inebriants. So these are the alcoholic preparations which cause neurotoxic effect. So these inebriants include alcohol, anesthetic agents like ether, chloroform, fuels include like kerosene, petrol, sedative and hypnotics like barbiturates, chloral hydrate, and insecticides include DDT and andrine. So these organophosphorus compounds like parathion and malathion, these all are included under insecticides. And some chloral, some coal derivatives are like naphthalene. are also included under cerebral neurotoxins. Further, some deliriants are also dhatura, cannabis, atropa belladonna, cocaine, camphor. So these are the deliriants also called hallucinogens. So these are included under cerebral neurotoxins. Other neurotoxin categorized into spinal neurotoxins. So, spinal neurotoxins may be excitants and depressant. So, excitant neurotoxin include nux vomica and its alkaloid like strychnine, and depressant include larynx sativus and jasmine. So the neurotoxins further categorized into third category, that is peripheral neurotoxins. So peripheral neurotoxins include conium and curare. So these are peripheral neurotoxins. Now the next category of poison is cardiac poison. So cardiac poison have mainly action on the heart. So when any poison then affect on the heart muscles or any musculature of the heart or the nerve supply that related to heart, that responsible for cardiac poison. So these poison generally produce deleterious effect on the action of heart due to poisoning of the cardiac muscle or of its conducting system. So they disturb the conducting system of the heart, and they produce very deleterious effect on the different functioning of the heart. They may increase the heart rate or they increase the blood pressure. So these are the cardiac poisoning. They are aconite, digitalis, oleander, and tobacco. See, these all examples included under cardiac poison. So I am repeating, cardiac poison have mainly action on the heart. They either directly act on the heart muscles or they act through nerve supply. So these poisons generally produce very deleterious effect on the action of heart or functioning of the heart. Next one is respiratory poison. So these poison also known as aspirant. It is a non-toxic or minimal toxic gas which reduces or displaces the normal oxygen concentration in breathing air. So respiratory poison, that also known as aspirant. Aspirant is a non-toxic or minimally toxic gas which displays the normal oxygen concentration in breathing air. So when the normal oxygen concentration depletes in air in our body, that may produce different hazardous effect. So these agents include respiratory poison, include carbon monoxide, carbon dioxide, sulfur dioxide, and var gas like chlorine, tear gas, phosphine. So these all are included under respiratory poison. Next category is miscellaneous poisons. So miscellaneous poisons include analgesics and antipyretics. So sometimes overdose of these agents may responsible for different poisonous effect. And here in miscellaneous category, different drugs are included which present in overdose, then they produce different type of poisonous effect in our body. These include antihistaminic, tranquilizers, stimulants like amphetamines, antidepressants, hallucinogens like LSD, food poisoning, drug dependence. So the excess amount of anything or any drug medicament in our body responsible for poisonous effect. Next is general treatment of poisoning. So the general treatment is given if the specific nature of the poison is not known. तो जनरल ट्रीटमेंट हमें कब देना है? फॉर द ट्रीटमेंट ऑफ पॉइजन व्हेन वी डोंट नो द स्पेसिफिक रीजन ऑफ द पॉइजन. The condition of patient is assessed by detailed clinical examination based on the degree of loss of consciousness. So firstly we have to assure what is the condition of patient. Okay, so how much degree of consciousness is present in the patient, and the presence or absence of other medical complications. So we firstly examine the patient, then after we can give the general treatment. The patient should be removed from the source of exposure. So this is the important thing, because we still remain in the contact of source of exposure, then the poisonous substance may produce a very harmful effect. So the patient should be removed from the source of exposure. Next is the degree of loss of consciousness is graded by different classifications. So how much degree of consciousness is present in patient? So that is also included under before general treatment. The degree of coma. So the degree of coma is also responsible, and this degree of coma is assessed by Glasgow coma scale. So these all factors we have to determine before giving the general treatment of poison. So I am repeating that general treatment of poison is related to the specific nature of poison. So if we giving the specific nature of poison, we know how the poison entered into the body, then we given this general treatment. The condition of patient is also important. So how much consciousness present in the patient, that is determine how much the patient should be given the general treatment or not. And next, very important thing, the patient should be removed from the source of exposure. So that is not in the contact of source of exposure. Next is aim of general treatment of poisoning. So the aim of poisoning treatment is related to remove the unabsorbed poison, and secondarily to treat and excrete the absorbed poison. So we know various poisons when entered into our body, that they still remain in stomach for prolonged time, and generally the absorption of many poisonous substances occur in intestine. So before absorption into intestine, if we remove the poisonous substances from the stomach, then we can reduce the hazardous effect of their or toxicity that can produce by these poisons. So to remove the unabsorbed poison through stomach is the important factor for the treatment of poison. To treat and excrete the absorbed, if the poison is absorbed, then the treatment is based on how can we excrete this poison, or how can we minimize the effect of the poison. So these are the general treatment of poison. Steps of general treatment include removal of unabsorbed poison, use of antidotes, elimination of absorbed poison, symptomatic treatment, and general care of patients. So these all are the steps of general treatment. As we discussed already, that removal of unabsorbed poison is very important, because if we remove the poison within time, it doesn't produce their hazardous effect or poisonous effect, then it is very important. Use of antidotes that minimize or that antagonize the effect of poison is also important. Elimination of absorbed poison. If poison is absorbed, then it can be eliminated by different agents or medicaments is also important for and categorized under general treatment, symptomatic treatment, which type of symptoms appear, and uh, we determine the symptoms and which poison can produce which type of symptoms. If we know all these parameters, then symptomatic treatment is effective, and general care of patient is also an important factor for the general treatment of poison. Common poisoning occurs. So there are various agents which produce common poisoning. Heavy metals. Heavy metals, as the environment is getting richer, and metallic contamination of food and water is also a common poisonous substances. So heavy metal, because we are living in environment, and environment contain different type of heavy metals, lead, mercury. So these heavy metals entered into our body and produce different type of hazardous effect. So these are the common poisonous substances. Many times we also use different utensils, and these utensils made from metals. So these metals leached from these metallic substances or metallic utensils during eating. So during eating, these metals uh, entered into our body, because uh, जो हम utensils यूज करते हैं ड्यूरिंग cooking or whenever we used during eating, then the metals can enter into our body. The poisoning can also occur because of insecticide or pesticide. So sometimes various insecticide or pesticide used in herbs, they also entered in our body. The poisoning can occur because of excessive use of drug. So drug overdose is also an important factor that can produce, that can enter various poisonous substances into our body. Heavy metals and cyanide poisoning, and the use of antidotes in these poisoning. So heavy metals and cyanide are the poisonous substances, which is an example of excessive use of drugs. So there are various antidotes are also available for the poisoning of these uh, overdose of drugs. Removal of poison or toxic agents from the body by antidotes. So what is antidotes? Any agent, substance that neutralizes or oppose a poison. So, what is the work of antidotes? They neutralize the effect of poison. So, these poisons may be drug, toxic agents, heavy metals, pesticides. So, these agents can produce different type of toxicity in our body, and antidotes work by neutralizing or opposing their work, or they counteract or minimize its harmful effect. So antidotes also work by counteract or minimize the harmful effect without causing damage to the body. So without causing any damage for our body, they work by minimizing the effect of toxins. So these are classified into physical, chemical, dispositional, receptor specific, and pharmacological or physiological. So antidotes divided into physical, chemical, dispositional, receptor specific, and pharmacological. So what is physical antidotes? So these substance prevents the absorption of poison by their presence. So as we know what is the mean of physical. So physically they present, these agents physically present in our body, and they reduce the absorption of poison by their presence. Okay, so they act locally and not systematically. So they are not entered into the blood, but they are present into the stomach or intestine. So they reduce the absorption of poison. So they are included under physical antidotes. These includes demulcent. So demulcents generally is a diluting agents. Demulcent are diluting agents that contain proteins to absorb poison. So whenever we use these demulcents, they are generally fats, oil, egg albumin, or milk in nature. So they are proteinous in nature and absorb the poison. All are used as antidotes for corrosive and irritant poisoning. So we already discussed what is corrosive and irritant poisoning. So these corrosive and irritant poisoning can be minimized by use of demulcents. And demulcent is fat, oil, albumin, and milks, all having proteinous nature or present different proteins. So these proteins absorb poison. Second is activated charcoal. Activated charcoal antagonize absorption. So charcoal is act as a adsorbent. So it absorbs the poisonous substance. So they minimize the effect of poison. So anti-activated charcoal is used for striking and mineral poisoning. So for the treatment of striking and mineral poisoning, we used activated charcoals. So they absorb the poisonous substances. Bentonite and fuller's earth for paraquat poisoning. So paraquat poisoning, we use bentonite, and they are generally toxic to gastrointestinal tract, kidney, liver, heart, and lungs. So they also produce different type of toxicity. Next one is chemical antidotes. So the chemical antidotes produce antagonism through chemical reaction. So as a term, the physical means they present physically. In chemical antidotes, they produce different chemical reactions and minimize the effect of toxins. So they may be local or systemic. So local chemical antidotes include neutralizers. Neutralizers further divided into sodium bicarbonate. So in neutralization, first example is sodium bicarbonate. So sodium bicarbonate generally used for ferrous ion toxicity. So ferrous carbonate, it form ferrous carbonate that form a non-absorbed complex. So neutralizers included sodium bicarbonates for ferrous ion and form ferrous carbonate that is a non-absorbed complex. Second is magnesium oxide. Magnesium oxide for mild acid. So mild acid react with magnesium oxide and form a non-absorbable complex. Similarly, starch is used for iodine. So and it gives a blue color. So when iodine present in excess amount, then starch act as a neutralizer. Second is first is in chemical antidotes we discussed. First is local and second one is systemic. So systemic antidotes, they reverses toxicity systematically. So the toxicity that occur systematically, that can be reversed by systemic antidotes. So systemic antidotes includes chelating agents. So these chelating agents attach to toxin, chelate it, and decrease availability. So chelating agents generally bind to toxin and chelate them and decrease their availability. So in chelating agent, first include succimer, that is 2,3-dimercaptosuccinic acid, DMSA, given in lead poisoning. So they generally bind with lead and form a chelate and reduce the absorption of lead poisoning. It works by trapping lead in the body and removing it in the urine. Okay, so succimer used in lead poisoning. Second one is dicarboxylic acid, that include succinic acid derivative. So these dicarboxylic acid generally chelates with lead, especially in children. So these dicarboxylic acid included succinic acid given in poisoning of lead. Next is British anti-leucite, that is known as VAL. So these contain two sulfhydryl group. So these act as an antidote of warfare gas toxicity. So VAL, which contains sulfhydryl group, generally used for the antidote of toxic warfare gases. Good chelating agent, it is also a good chelating agent against mercury and lead poisoning. So wall is also British anti-leucide, also used in mercury and lead poisoning. Next is calcium disodium EDTA. So EDTA, ethylene diamine tetraacetic acid, is also used as antidote, and it prevents chelation of uh, calcium ion, but chelates other ion and heavy metals like lead, cadmium, and mercury. So it when it chelates with lead, cadmium, and mercury, it form a insoluble complex and also reduce the toxicity of these heavy metals. When calcium, sodium EDTA and wall are giving together, British antileucide giving together, then it is very effective when the blood having higher amount of lead toxicity. So 70 microgram per deciliter, uh, if the blood present greater than 70 microgram per deciliter lead, then it can be treated by the combination of calcium EDTA and wall. Diferoxamine, also used for the chelation of iron. So iron toxicity can be reduced by the use of diferoxamine. Cupramine is also a chelating agent that generally chelate with copper. So it is used in copper toxicity. Next is protamine sulfate. Protamine sulfate is a systemic antidote for heparin overdose. So when heparin overdose increased, that is a thinner that control our blood, that is a thinning agent. So protamine sulfate also a systemic antidote for heparin overdose. Next is digoxin. Digoxin, it is also a systemic antidote for digoxin overdose. So FAB, that is known as digibind or digifab obin, it is generally used for overdose or toxicity of digoxin. So greater than 2 nanogram per ml, if digoxin present in our body, then it may produce toxicity, and this can be reduced by the using of ovine. Botulinum toxin. So most toxic agent, uh, that is the very toxic agent and generally used to counteract the part and counteract the toxicity of different toxic agent. So, botulinum toxin is used therapeutically to correct uncontrollable blinking, crossed eyes, inhibit sweating, facial wrinkling, chronic migraine. So, the toxicity in adult is treated with antitoxin. Toxicity in infant is treated with botulism immune globulin. Next one is dispositional antidotes. So we already discussed the chemical antidotes, physical antidotes. Now dispositional antidotes. So dispositional antidotes generally reverses the action of the poison by affecting their metabolism and excretion. So the dispositional antidotes generally act by the reverses the action of poison by their metabolism and excretion. So the function of dispositional antidote is making alteration of absorption. So they alter the absorption of poison, their distribution, their metabolism, and excretion. So they reduce the amount of toxic agents available for the tissue. So metabolism, firstly we come into the metabolism. So dispositional antidotes as perform their action by metabolism. So toxicity of metabolites or or the parent compound when produce any toxicity, then it produce different hazardous effects. So toxic agents generally, if we taking example of methanol, so methanol, also known as wood alcohol, contain one carbon and produce more toxic metabolites. So methanol produce more toxic metabolites. So toxic, it is more toxic than ethanol, and methanol convert into formaldehyde, one carbon, and further it convert into formic acid. So methanol form different metabolites in which first it convert into formaldehyde and further it converted into formic acid that contain one carbon atom, and no further metabolism is occur after formation of formic acid. No further metabolism is occur. So formic acid accumulates in our body and leads to acidosis. So formic acid actually causing the acidosis. So the methanol, when metabolized into formaldehyde and further formic acid, then the deposition of this formic acid lead to toxicity or acidosis. So here I define how the metabolism included under dispositional antidotes and how can we treated this uh, uh, metabolism, or how can we stop the metabolism of drug by using of different agents and can minimize the toxic effect of these metabolites. So as I given the example of methanol, and these methanol having one carbon atom, and it convert into different metabolites like formaldehyde, formic acid. So these formic acid produce acidosis and also responsible for electrolyte imbalances and also responsible for CNS depression. So these all are the toxic effect of this formic acid. So how can we minimize this toxicity? So we change this methanol into ethanol. So ethanol is metabolized by the same enzyme and will produce competition for methanol. So when ethanol is present, what will happen? Ethanol has a greater affinity for alcohol dehydrogenase, and ethanol converted into formaldehyde, and then it converted into acetaldehyde that containing two carbon atom, and that further converted into acetic acid, and that finally convert into carbon dioxide and hydrogen. So the ethanol metabolism proceed in this way, which prevents methanol poisoning. If we replace methanol by ethanol, then ethanol finally gives CO2 and H2O. And this, in this way, we can reduce the methanol poisoning in our body. Ethanol sometimes produce CNS depression. So methanol, if remain in our body, that will be excreted by the lungs and kidney. So, and in another way, the formaldehyde, that is a metabolite of ethanol and also a methanol. If this metabolite accumulated, then cause blindness. So the removal of this metabolite is also essential and can produce toxicity. And formic acid, that a metabolite of methanol is also produce severe acidosis and coma. So these all metabolites responsible for toxicity, and different dispositional antidotes are used to reduce or minimize the toxicity of these metabolites. In another example, we can see the overdose of acetaminophen. So overdose of acetaminophen still remain in our body, then it produce hepatotoxicity. Okay, so it produce hepatotoxicity. So uh, its metabolic product have a toxic effect, but this toxic effect can be reduced by conjugation with glutathione. So if we form a conjugated product of this toxic metabolite, then it convert into non-toxic agents. So acetaminophen toxicity can be treated by an acetylcysteine antidote. Okay, so this is another example of disposable antidotes with metabolism. Okay, so here, as we discussed that what is the role of metabolism and how different toxic metabolites are prepared, and how can these metabolites can be inhibited by the using of antidotes. So in acetaminophen toxicity, we are using an acetylcysteine antidote. Okay, and this an acetylcysteine antidotes resemble the function of glutathione, and which is sulfahydryl group SH group donor. And this sulfhydryl group SH donor group bind with toxic metabolite, SH group bind with toxic metabolite and form a conjugated product. Other dispositional antidotes include excretion. So excretion, any agent that accelerates the excretion of toxic substance, they can reduce the toxicity of poison. So it includes bromides, so salt with some toxicity at higher doses. So bromide salts with some toxicity at higher doses and produce CNS depressant effect, and it excreted by kidney. Chloride will enhance push bromide excretion. So chloride produce dispositional metabolism well tolerated. So when the bromide is replaced by chloride, then it we can minimize the toxicity. So that is a way through excretion. So we induce the excretion of bromide here by replacing the chloride. So we can minimize the CNS depressant effect. Okay, so as we discussed that bromide salts which produce toxic effect in high dose, that can be excreted by kidney. Secondary, the strontium, earth metal belonging to the calcium ion family, that is very toxic. Calcium ion displaces strontium. So calcium ion, when strontium that is very toxic, when it replaces by calcium ion by excretion, that forces the excretion of strontium. So it is also included under dispositional meta mechanism. Next is thallium. Thallium, which is a rodenticide and pesticide, act as a very toxic and lethal effect. So potassium chloride is used as a displacing agent and enhance the excretion. So for bromide, if we are discussing about dispositional antidotes uh, as excretion, so we have discussed that bromide, which is toxic, and uh, the excretion of bromide increased by the replacement with chloride. Next is strontium, as we discussed that strontium that producing very toxic effect, that can be replaced by calcium ion. So calcium ion displaces strontium. Next is thallium. Thallium, a rodenticide or pesticide, very toxic or lethal effect, having a very toxic or lethal effect, that is displaced by potassium chloride. Okay, so these all agents increase the excretion of the toxic agents. Next, dispositional antidotes for excretion include diuretics. So, iron trapping is forced removal of substance by trapping it in urine. So, iron trapping changes the pH of urine. Iron trapping is done in specific conditions, depends on alkaline poison, acidic poison. So in alkaline poison or acidic poison, we used iron trapping agents. Okay, so the functioning renal system. So renal system should be functioning. If you have any problem with renal system, then it is not work. So iron trapping is done by a specific condition in alkaline poison or acidic poison. So in acidic poison, there are salicylates and barbiturates. So alkaline urine, by using intravenous infusion of sodium bicarbonate, so the intravenous infusion of sodium bicarbonate, they neutralizes the effect of salicylate or barbiturates that actually produce acidic poison. So 1 to 2 milli equivalent per kilogram generally used as a neutralizing agent. So after this is when we use the sodium bicarbonate, we make sure the pH of urine should be more than 8. It also renders the urine alkaline and will ionize acidic drug and poison. So as we know, we are using sodium bicarbonate and it has a basic in nature, so uh, it make alkaline urine, and uh, that will ionizes the acidic drug and reduces the effect of poison. Second is basic poison. So cocaine, alkaloid, and nitrogen and amphetamines generally included under basic poison. So we generally acidify urine by using ascorbic acid. So when these present in urine and they are basic in nature, then we acidify urine by using ascorbic acid or ammonium chloride. So when we used these acidic agent, then they neutralize or they produce ions with basic poisons. So intravenous infusion we generally used for it to acidify the urine. Uh, uh, Sorry, acidify urine by using ascorbic acid or ammonium chloride through intravenous infusion. To acidify the urine, pH lesser than 5. So generally, acidic agents used, they reduce the pH below the 5 and ionize the basic drug. So they minimize the toxic effect of basic poison. So for the acidic poison, we are using alkaline agents like sodium bicarbonate, and that increase the pH greater than it. And for basic poison, we used acidic agents and like ammonium chloride, and that reduce the pH below than 5. And these all agents generally ionize the drugs and reduce their effect. Next is pharmacological antidotes. So these are most specific due to their pharmacological action, only affect poison. So they having least side effects. So pharmacological antidotes include the those agents which having a specific role into pharmacology. Okay, so they actually associated with receptors. So they also known as receptor antidotes. So pharmacological antidotes known as receptor antidotes because they act on receptors. So like anti-atropine, we know very popular agent atropine. Atropine act by competitively binding to muscarinic receptors. So atropine is antagonist of acetylcholine. So acetylcholine toxicity can be reduced by atropine. So that is a receptor blocking agent. So here they prevent acetylcholine from binding to the receptor. So atropine generally prevent the binding of acetylcholine to the receptor, and they are sending impulses to the muscle. So they inhibit the movement of muscle. So it is also an antidote for muscarinic compounds. It is also an antidote for nerve gas, and it is also used in organophosphates, that is highly toxic, and we know that organophosphates responsible for that in a minute. Further, neostigmine, that is cholinergic and agonist, that is also used as antidote for muscle relaxant. And uh, tubocurin blocks the neuromuscular junction competitively. That produce only peripheral effects. Antidote for cholinesterase inhibitor, neostigmine. We are discussing about neostigmine, and that used as a antidote for cholinesterase inhibitor, that acetylcholine accumulates. So quaternary ammonium ion also used, and furthermore we used naloxone, naltrexone. So that is a pure opioid antagonist. So they are generally used in the toxicity of morphine. So they are a agent as an antidote for morphine poisoning. So they are generally naloxone or naltrexone generally used in the overdose of narcotic analgesic agents such as morphine. So they used in the treatment of morphine poisoning, naloxone or naltrexone. Next is physiological antidotes. So these agents uh, produce effects opposite, so that the poison, but not on the same receptor. So physiological agents included those agents that produce effect opposite to the action of poison, but they not act on the same receptor. It includes epinephrine. So epinephrine used for anaphylactic shock, and that is severe cardiovascular collapse and bronchoconstriction. So, ephedrine generally used for this purpose. Epinephrine reverses uh, this way by increasing blood pressure and causing bronchodilation. So, in anaphylactic shock, where bronchoconstriction occur, so epinephrine generally reverses by increasing blood pressure and causing bronchodilation. Tetrahydrofolinic acid, leucovorin, that reduced form of folic acid, tetrahydrofolinic acid, it is a reduced form of folic acid used as an antidote for methotrexate poisoning. So tetrahydrofolinic acid used in methotrexate poisoning. It is the drug methotrexate. We know that used in cancer treatment, and also used in arthritis. So that tetrahydrofolinic acid used as an antidote of methotrexate poisoning. It is also used in ulcer toxicity, in loss of hair, and when decreased blood count and decreased platelet count. So, in all these conditions, we used tetrahydrofolinic acid, give folinic acid, a derivative of folic acid. So, these all are included under physiological antidotes. that include epinephrine and tetrahydrofolinic acid. Removal of the absorbed poison of the absorbed portion of the poison. So this process uh, actually entail some risk because poison is being removed from the systemic circulation. So systemic circulation, poison should be removed. Before this, we already discussed that when poison entered into the stomach, then they still remain for few hours, and before absorption of these poison, if we removed through the body, then the toxicity can be minimized. So the 4 to 5 hours after entering the poison in our body is very essential, and within this hour we excrete through oral cavity or any way, then the uh, poison can be minimized. So the removal of absorbed poison can be proceed by to process. Uh, uh, Actually, it is used when patient is seriously poisoned or seriously non-toxic agent. That level of poison increased in the body, and there are different way where the poisonous substance increased in our body. So removal of absorbed poison is very essential, and this removal can be proceed by different way. First one is natural way, and second one is artificial way. So the natural way includes diuresis. So if any poisonous substance absorbed in our body and present in blood, then the natural way include induce diuresis. So by using these diuretics, we speed route of elimination for the xenobiotics metabolism or excretion, because the poisonous substance, how poisonous substance act, because it form toxic metabolite, and these toxic metabolite, if we eliminate through the body within time, then the toxicity can be reduced. Second one is artificial way. So artificial or mechanical way is another way that include peritoneal dialysis, used in cases of renal failure. If any person having renal failure, so we can't use diuretics, so there we used peritoneal dialysis. And second, extra corporeal, outside the body, like hemodialysis. Hemodialysis is generally performed outside the body, so that is called extra corporeal dialysis, and it involves the removal of the blood from the body and purify, then given back through a vein. So that is extra corporeal hemodialysis. So through that way, we can remove the poisonous substances from the blood. And next one is hemoperfusion. So hemoperfusion most risky because no dialysis involved. Blood is perfused through an absorbing substance like charcoal. So by the using of charcoal, we perform hemoperfusion, and that is very risky process. So we discussed there the removal of absorbed portion of poison through natural way and artificial way. And natural way include using of diuretics, and artificial way include peritoneal dialysis, extra corporeal hemodialysis, and hemoperfusion. Antidotes, on the basis of their mechanism of action, divided into physiological antidotes, chemical antidotes, and mechanical antidotes. We already discussed that what is physiological antidotes. They act by producing their effect opposite to the poison or counteract the effect of poison physiologically, that present in gastric environment, and before entering of further, uh, we can remove before absorbing, we can remove through gastric larvae. So we the physiological antidotes act. Chemical antidotes, they act usually by combining with the poison. So they form a chemical bond with poison and thus changes its nature, and poison cannot act anymore. So they change the nature of poison by forming a chemical bond. So the chemical antidotes act by forming a chemical bond. Next is mechanical antidotes. So they usually act by preventing the absorption of poison in the body. So mechanically, they preventing the absorption of poison in body or expelling out the poison by emesis or elimination through urine. So mechanical antidotes work by these processes. Second, next is heavy metals and their antagonists. So the common heavy metals, lead, mercury, these responsible for poisoning and are salts of arsenic, lead, mercury, iron, cadmium. These all are poisonous substances and included under heavy metal poison. So heavy metal poisoning occurs because of overdose intake or because of their incomplete metabolism in the body. So heavy metal poisoning also produce a serious effect in our body. Depending upon the content and type of heavy metal, the toxic effect can be seen and treatment will be given after seeing what the effect produced by the specific heavy metals. The initial treatment in heavy metal poisoning is to administer activated charcoal. So whenever any heavy metals enter in body and produce toxicity, then the first treatment is by administration of activated charcoal because it a very good adsorbent. So it absorbs the heavy metal or poison. It is followed by administering compound which are able to produce emesis, and furthermore we also induce the emesis so the heavy metals can be eliminated by the body. So first we comes on the activated charcoal. So what is the activated charcoal? How can we prepare? What is the use of activated charcoal? So first of all, we discuss the preparation of activated charcoal. So commercially, it is obtained as a residue during destructive distillation of various organic matter. So various distillation process of organic matters form activated charcoal from binding of organic material in a specific matter. So the process produce activated charcoal. The coarse material is crushed and powdered. So the activated charcoal commercially obtained by the destructive distillation of various organic matter or from binding of organic material in a specific manner. Properties: it is a fine, black, odorless, tasteless powder having smooth touch and free from gritty particles. So, it is the property of activated charcoal. The fine powder provides more surface area for adsorbent property. So, it is very fine powder and produce a large area which perform a better absorbent properties. Action and uses, if we are discussing about what is the action of it, so it is a general type of adsorbent used in poisoning. So it act as a adsorbent and that adsorb the poison. It absorbs heavy metals and also absorbs drugs such as hypnotics, sedatives, alkaloid, etc. So it absorbs activated charcoal, absorb heavy metals, lead, mercury, and also absorb drugs such as hypnotics, sedatives, alkaloids. Okay, so when these drugs produce any type of poisonous effect, then can be treated by the using of activated charcoal. And some gases that are poisonous in nature, like carbon monoxide, carbon dioxide, nitric oxide, these also adsorb on activated charcoal and can be minimize the toxic effect of these gases. It is normally employed in the ratio of 5 is to 1 or 10 is to 1, charcoal to poison. So uh, what is the ratio we generally used? How much amount of poison present so that the charcoal may be used as 5 times or 10 times from the quantity of poison. It is administered in the form of tablets. So activated charcoal can be administered in the form of tablets. It also finds use in diarrhea to absorb toxin. So it also used in diarrhea to absorb toxins. Cyanide poisoning. So cyanide poisoning normally takes place accidentally or when cyanide poison is taken intentionally to commit suicide. So cyanide ions combines with ferric ion of cytochrome oxidase, an enzyme which is responsible for electron transfer reaction. So cytochrome oxidase is a enzyme which responsible for electron transfer reaction and cyanide ion combines with ferric ion of cytochrome. So it reduce the working of cytochrome and cytochrome is essential for electron transfer reaction. So the cyanide poisoning is very uh, hazardous effect uh, and perform the improper function of cytochrome oxidase. So this causes stoppage of cellular respiration and metabolic reaction. So these poisons generally stop the cellular respiration because it depend on cytochrome oxidase and the iron ferric ion of cytochrome oxidase combined with cyanide ion. So the functioning of cytochrome oxidase is disturbed and that responsible for disturbance of respiration and metabolic reactions. So antidotes in cyanide poisoning generally use sodium nitrite and sodium thiosulfate. Both are used in conjunction with each other. So sodium nitrite and sodium thiosulfate can be used in conjunction with each other. So that all about cyanide poisoning. First of all, the intravenous infusion of sodium nitrate injection is given. So in the cyanide poisoning, firstly we given the intravenous infusion of sodium nitrite. This is then followed by sodium thiosulfate infusion. Okay, so firstly we given the sodium nitrate infusion, then sodium nitrite injection, then given sodium thiosulfate infusion. The sodium nitrite is able to convert hemoglobin to methemoglobin, which binds cyanide ion. Okay, so sodium nitrate, what is what is the working of sodium nitrate? It able to convert hemoglobin to methemoglobin. So these methemoglobin binds with cyanide ion. Thus, cyanide poisoning of cytochrome oxidase gets prevented. So sodium nitrite, how it is working? So we discussed how it can be minimized the cyanide poisoning because it convert hemoglobin to methemoglobin and which bind with cyanide ion and we can reduce the cyanide poisoning of cytochrome oxidase. However, the cyanide methemoglobin complex slowly get dissociated. So the sodium thiosulfate convert this immediately to non-toxic thiocyanate which get excreted by kidney. So the sodium nitrite working by conversion of hemoglobin to methemoglobin and reduce the toxicity of cyanide and sodium thiosulfate convert cyanide to non-toxic thiocyanate and this non-toxic thiocyanate can be excreted by the kidney. Sodium nitrite. So sodium nitrite NaNO2, how it can be prepared? So this is manufactured by passing of nitrogen oxide gas obtained during the catalytic oxidation of ammonia and oxygen in sodium carbonate solution. So the solution is concentrated to crystallize out the product. So sodium nitrate is prepared by the using of nitrogen oxide gas that reacted with sodium carbonate in the presence of oxygen. Okay, so that gives sodium nitrite and carbon dioxide. So sodium nitrite is prepared by manufactured by passing nitrogen oxide gas obtained during the catalytic oxidation of ammonia and oxygen in sodium carbonate solution. Okay, you understand how sodium nitrite is prepared. So the properties of sodium nitrite include sodium nitrite occurs in the form of white granular powder or as a white crystals. So it is found as a granules that in white in nature, that is white in nature, or as white crystals having a saline test. It is water soluble, sparingly soluble in alcohol. When exposed to air, it deliquescent gets slowly oxidized to sodium nitrate. Okay, so sodium nitrite oxidized to sodium nitrate when comes in exposure to air. It is easily decomposed by acidification with dilute sulfuric acid. So it is also decomposed by acidification with dilute sulfuric acid. So when we use dilute sulfuric acid, it decomposes. Chemically, it acts as a reducing agent and gets oxidized in acidic medium. So it also a reducing agent and oxidized in acidic medium. Occurrence so less than 5% of daily nitrite intake comes from cured meats. Nearly 93% of nitrite comes from leafy vegetables and tubers and our saliva. So 93% of nitrite come from leafy vegetables. So vegetables contain sodium nitrite. So vegetables contain sodium nitrate, which is converted to nitrite when it comes into contact with saliva in mouth. So whenever we take leafy vegetables which contain sodium nitrite, when this sodium nitrite comes with contact of saliva, then it converted into sodium nitrite. So sodium nitrate converted into sodium nitrite by the action of saliva. There is another source of nitrite in the body, nitric oxide. Oxide is an amazing chemical that the body uses to control blood pressure. So nitric oxide used in controlling of blood pressure, kill tumor cells and heal wounds. When nitrite oxide is done with its work, it byproduct its nitrite. So whenever this nitrite oxide work, then its byproduct is nitrite, sodium nitrite. So this is also another source in our body why nitrite oxide. Physical properties. So its formula is NaNO2 sodium nitrite. Its molecular weight 69 gram per mole. Physical properties. Other physical properties includes it is a white to slightly yellowish crystalline powder that is very soluble in water and it is hygroscopic in nature. Its odor, it have a specific odor density 2.168 gram per cubic centimeter, solubility it is freely soluble in water and soluble in alcohol, melting points it's having 271 degrees centigrade melting point, pH between 7 to 9. So these all are the physical properties and further chemical properties. So in the laboratory, sodium nitrite can be used to destroy excess of sodium azide. So sodium azide, that is NaN3, can be treated with sodium nitrite in the presence of acid. Then it releases nitrogen, nitric oxide, sodium ion, and water. So in laboratory, sodium nitrate can be used to destroy the excess of sodium azide. So that is the reaction you can see here, how the sodium azide reacted with sodium nitrite and form and releases the nitrogen gas. Above 330 degrees centigrade, sodium nitrite decomposes in here. So above 330 degrees centigrade, sodium nitrite decomposes to sodium oxide, nitric oxide, and nitrogen dioxide. So sodium nitrite, NaNO2, decomposes into sodium oxide, nitric oxide, and nitrogen dioxide. You can see here what is the formula of sodium nitrite, NaNO2, and it convert into sodium oxide, uh, nitric oxide NO and nitrogen dioxide NO2 and sodium oxide Na2O. Sodium nitrite can also be used in the production of nitrous acid. So it is used in the production of nitrous acid via sulfuric acid. So sodium nitrite when react with sulfuric acid, it produce nitrous acid HNO2 and sodium sulfate. So nitrous acid and sodium sulfate can be produced by sodium nitrite. Okay, so chemical properties, we discussed that how it react with excess of sodium azide and how the sodium nitrite decomposes into sodium oxide, nitric oxide or nitrogen dioxide, and further we also discussed that it also used in production of nitrous acid and sodium sulfate. The nitrous acid, which produced in the previous reaction, uh, decomposes in further into sodium nitrite, nitric oxide, and nitrogen oxide. As we discussed that sodium nitrite, when react with H2SO4, it form nitrous acid and sodium sulfate, and this nitrous acid further decomposes into sodium nitrite, nitric oxide, and nitrogen dioxide. The nitrogen dioxide of period decomposition is then routed through condenser or fractional distillation to react with water and yield nitric acid. So this sodium nitrogen dioxide which we get in the reaction that further react with water and form uh, nitric acid and nitrous acid. So preparation, how sodium nitrite can be prepared. So the preparation include the salt is prepared by treating sodium hydroxide with mixtures of nitrogen dioxide and nitric oxide. So sodium nitrite is prepared by the reaction of sodium hydroxide when react with nitrogen dioxide and nitric oxide. So we can get sodium nitrite with the release of water. So the conversion is sensitive to presence of oxygen. So this conversion is very sensitive to presence of oxygen, which can lead to varying amount of sodium nitrite. So the oxygen can interfere the reaction and the amount of sodium nitrate. In Previous time, the sodium nitrite was prepared by reduction of sodium nitrate with various metals. So, by the using of this technique, previously sodium nitrate was prepared. So, in that method, sodium nitrate reacted with various metals. Sodium nitrite can be prepared from sodium carbonate also. So as we know, the caustic soda or soda ash solution absorbing gas containing a small amount of nitrous oxide and nitric oxide used in nitric acid, or it is used in the production of sodium nitrite. So the absorbing nitrogen oxide to obtain a nitride, the theoretical composition of nitrogen oxide for nitride formation is equal proportion of nitric oxide and nitrogen dioxide. So here the equal proportion of nitric oxide and nitrogen oxide are used with sodium carbonate. So sodium carbonate when react with equal proportion of nitric oxide and nitrogen dioxide, it produce sodium nitrite. Uses It is mainly used as antidote in cyanide poison and has a hypotensive effect. So we already discussed what is the cyanide poison. So in cyanide poisoning, we used sodium nitrite as antidote, and it also produces a hypotensive effect. It has relaxant action on smooth muscles, so it is also used as a vasodilator. It prevents rusting of surgical instruments. So rusting of surgical instrument can be prevented by the using of sodium nitrite. So when we use these instruments, then we immerse them in dilute solution of sodium nitrite. So that further prevent the rusting of these instruments. It is also used as food preservative. So it is used in food preservative also. Further non-pharmaceutical use, the main use of sodium nitrite is for industrial production of organonitrogen compounds. So organonitrogen compound can be produced by the using of sodium nitrite. It is a reagent for conversion of amides into diazo compounds. So the diazo compounds can be prepared by the using of sodium nitrite. Diazo compounds containing N2 groups, nitrogen triple bond nitrogen groups, which are the key precursor to many dyes such as azo dyes. So these diazo compounds used in the preparation of different dyes. Nitroso compounds are produced from nitrites. So nitroso compounds are also produced by nitrites. These are used in rubber industry. So nitroso compound used in rubber industry. Other application include in photography. So sodium nitrite can also be used in photography. It may also be used as an electrolyte in electrochemical grinding. Okay, so it is used as a electrolyte. Manufacturing processes typically diluted to about 10% concentration in water. So generally used uh, in 10% concentration. It is used in a variety of metallurgical application for phosphatizing and da- detoning. So there are the various purposes of sodium nitrite used as non-pharmaceutically. Sodium nitrite Sodium nitrite is an effective corrosion inhibitor. So it is also used as a corrosion inhibitor, and as we discussed, it used in the surgical instrument. So uh, when we prevent the rusting of when we want to prevent the rusting of surgical instrument, then we immerse these surgical instrument into dilute solution of sodium nitrite. Sodium nitrite is an effective corrosion inhibitor and is used as an additive in industrial greases. So it is used as corrosion inhibitor and used as a grease. As an aqueous solution in closed loop cooling system and molten state as heat transfer medium. Sodium next drug is sodium thiosulfate. So sodium thiosulfate NO2 S2O3 into 5H2O, that is sodium thiosulfate. So how it is prepared? So it is obtained from soda ash, sulfur dioxide and sulfur. So sodium carbonate is dissolved in hot water and then pass sulfur dioxide. So sodium carbonate when dissolved in hot water and passed over sulfur dioxide, the resulting solution of bisulfide liquor is treated with a further quantity of soda ash, means we used further sodium carbonate, which is then made to heat with sulfur. The solution is then concentrated, allowed to settle and recrystallize. So you can see through this reaction that sodium carbonate when react with uh, SO2, sulfur dioxide in the presence of water, then it convert into NaHSO4, sodium bisulfate, plus CO2. And this sodium bisulfite uh, further react with sodium carbonate, it produce sodium sulfate plus H2O plus CO2. And sodium sulfate further react with further reacted with sulfur, then it produce sodium thiosulfate. Okay, so this is the whole reaction that defining the preparation of sodium thiosulfate, and its formula is Na2S2O3 into H2O. Properties: it is colorless crystal or coarse crystalline powder or a transparent monoclinic prismatic crystals. It is odorless and having an alkaline test. So it is odorless and having an alkaline test. It melts at 500 degree centigrade temperature while decomposes on being heated at 100 degree centigrade temperature. So it efflorescences, it produces efflorescence in dry air and deliquescence in moist air. So it is insoluble in water, but it is soluble in water but insoluble in alcohol. So these all are properties. Furthermore, in its anhydrous form, sodium thiosulfate has a molar mass of 158.11 gram per mole. The more commonly available pentahydrate form is Na2S2O3 into 5H2O. That's molar mass is 248.18 gram per mole. So anhydrous form having the molar mass 158 and the hydrated, that is pentahydrate form, having the molar mass 248.18 gram per mole. It has a white crystalline appearance as a solid and is odorless. The density of sodium thiosulfate corresponds to 1.667 grams per cubic centimeters. The pentahydrate of this salt has a melting point of 321.4 Kelvin and a boiling point of 373 Kelvin. The solubility of sodium thiosulfate in water is 70.1 gram per 100 ml at 20 degrees centigrade and 231 gram per 100 ml at 100 degrees centigrade. The crystal structure of sodium thiosulfate is monoclinic. So the crystal structure is monoclinic. Chemical properties, so they also soaked different chemical properties. So the sodium thiosulfate salt is neutral in charge. So the sodium thiosulfate is neutral in charge. However, it dissociates in water and some other polar solvent to yield sodium ion and thiosulfate ion. So, despite being stable at standard condition, the sodium thiosulfate salt decomposes at higher temperature to yield sodium sulfate along with sodium polysulfide. So, sodium thiosulfate decomposes at higher temperature to yield sodium sulfate along with sodium polysulfide. The chemical equation for the reaction described below, the sodium thiosulfate Na2H2O3 that at high temperature decomposes to Na2SO4 and Na2S5, sodium sulfate and sodium polysulfide, that is Na2S5. When exposed to dilute acid such as dilute hydrochloric acid, the sodium thiosulfate salt undergoes a decomposition reaction to yield sulfur along with sulfur dioxide. So you can see the sodium thiosulfate when reacted with dilute hydrochloric acid, then it forms sodium chloride, SO2, H2O, and sulfur. The alkylation of sodium thiosulfate yield sulfur alkyl thiosulfate. Okay, so the alkylation product, that is S-alkyl thiosulfate. These compounds are commonly referred as Wundt salts. Furthermore, the assay of sodium thiosulfate, so it is acid by titration with standard iodine solution with starch as indicator. So sodium thiosulfate acid by the using of standard iodine solution with starch as an indicator. So here what is the process of this assay? It include the weighing of 0.8 gram of sodium thiosulfate and dissolve into 30 ml of water in a conical flask. So we using a conical flask and taking the sodium thiosulfate and dissolve in water, then it titrated with zero point 0.1 normal standard iodine solution. So iodine solution we taking in the burette and the sodium thiosulfate in conical flask. And when this burette content slowly drop down into conical flask, then we determine the endpoint. So generally, we add 3 ml of star solution in this quantity what we have decided that actually starch solution waste on the sodium thiosulfate quantity. So starch solution is used as an indicator and we determine the endpoint. So at the endpoint, yellow color of iodine is recognized. The approach of the endpoint can be recognized by the yellow color of iodine, which get discharged by shaking for a few seconds. So the color which appeared due to iodine that can be disappeared after few seconds when we shake. Here, the each ml of zero point 0.1 normal iodine is equivalent to 0.02482 gram of sodium thiosulfate. So that is the equilibrium equation, and it is calculated on the basis of determination of normality. So uh, firstly, we balance the equation and determine how much iodine and how much sodium thiosulfate required to reaction for each other and getting the endpoint. And on the basis of this normality, we determine this equivalent equation. So here you can see how the assay experiment performed for the determination of sodium thiosulfate. So you can see here The beaker we have taken, in which we included sodium thiosulfate and water, and it is titrated by the using of zero point 0.1 normal iodine solution. So we determine the endpoint and can we determine the quantity of sodium thiosulfate. Sodium thiosulfate has been included in pharmacopea as an antidote of cyanide poisoning, so it is the important agent that used in cyanide poisoning. So for this purpose, 10% weight by volume solution is used intravenously. Okay, although a 2.98% weight by solution is isotonic. It reacts with the cyanide ion to form relatively harmless thiocyanate. So, as we discussed earlier, how the cyanide poisoning occur and how the sodium nitrite and sodium thiosulfate act. So, as we discussed, that sodium nitrite um, generally changes the hemoglobin form, methamoglobin, and that reduce the cytochrome oxidase changes and reduce the cyanide poisoning. In the similar way, the sodium thiocyanate act by mm, uh, it react with cyanide ion to form relatively harmless thiocyanate. So it produces thiocyanate that is relatively harmless. Sodium thiosulfate is also a very important reducing agent, so it is used as a reducing agent. Used as a standard titrant in iodimetric analysis, so where the iodic compound, iodine derivative compound we used in titration. It is also used as a standard titrant in iodimetric analysis. It should be stored in tightly closed containers. Next topic is astringent. So an astringent substance is a chemical compound that tends to sink or constrict body tissue and precipitate the protein. So astringent generally act by shrinking or constriction of body tissue. So they reduce the absorption. They generally precipitate the protein. So they form a protective layer on the surface of skin. Due to their protein action, astringent are able to reduce the cell permeability. So they reduce the permeability of cell. So they further responsible for different other effects, which includes they reduce local edema, exudation, and inflammation. So these are the other effects that is produced by astringent compounds. The word astringent derives from Latin and stringere mean to bind fast. They are usually applied to damaged skin topically or to mucous membrane of GIT, including mouth. So they are usually applied to damaged skin topically or the mucous membrane of GIT tract, including the mouth. So they are the topical agents. Astringents are topical agent, and generally, as we discussed, that they generally act by shrinking or contraction of the body tissue and produce different protection action topically. So, what is the characteristics of astringent? Affect only the superficial. They affected only the superficial layer. Reduce cellular permeability. So they reduce the cellular permeability. Make the surface mechanically strong and decrease exudation. So they mechanically strong the outer surface topically. Protect from external irritation. So they also protect from external irritation. Causes local styptic and local antiseptic action. Many interfere with the function of pan receptor. They may interfere with the function of pan receptor and the pan relieving action is mild. They contract the blood vessel to stop bleeding. So these are the characteristic properties of astringent. So they contract constrict the blood vessels to stop bleeding. They also protect from external irritants. They make a surface mechanically strong. Okay, so they decrease exudation. Furthermore, they may interfere with the function of pan receptors. So pan relieving action is also produced, but it is very mild. Topical agent, if we are discussing about astringent, then we also know what is the topical agents and how the topical agents work. So we will discuss a little about it. So topical agents may potentially achieve a similar level of efficacy compared with oral formulations without the associated systemic side effects. Okay, so topical agents generally applied on the upper surface of skin and without producing any systemic side effect. Some evidence has shown that typically delivered agents can accumulated systemic topically delivered agents can accumulated to therapeutic concentration within the local tissue to which they have been applied while maintaining low serum and levels and subsequently resulting in less organ toxicity. So as we know, they are applied topically, so they have lesser systemic effect and they accumulated uh, to their therapeutic concentration within the local tissue, so they produce local effect. Furthermore, if we discussing about skin, so the skin has multiple layers of ectodermal tissue guards, the underlying muscles, bones, ligaments, and internal organs are protected by skin. Through nearly all human skin is covered with hair follicles. It can appear as hairless also. Secondary, if we discuss about cutaneous, then cutaneous means of the skin because it interfaces with the environment. Cutaneous is the outer face of skin. So because it interfaces with the environment, skin plays a key role in protecting the body against pathogens and excessive water loss. So skin plays an important role in protection of our body. Its other functions are insulation, temperature regulation, sensation, synthesis of vitamin D, and the protection of vitamin B folates. Severely damaged skin will try to heal by forming scar tissue. This is often discolored and depigmented. So severely damaged skin healed by scar tissue. Skin has, as we know, the skin has three layers. The epidermis, that is the outermost layer of the skin, provides a waterproof barrier and creates our skin tone. Next is dermis, that is beneath the epidermis, contain to connective tissue, hair follicles, and sweat glands. So it connected with the connective tissue, hair follicles, and sweat glands. The deeper subcutaneous tissue, that is hypodermis, is made of fat and connective tissue. So you can see here in this diagram, the epidermis layer is the outer layer. Then it is connected with dermis, and this dermis having connective tissue, hair follicles, and sweat glands. And furthermore, this dermis connected with hypodermis. So this hypodermis, which made of fat and connective tissue. So the topical agents generally uh, perform in this way. And the function of skin, first is protection. So it is a anatomical barrier from pathogens and damage. Sensation, so it contains a variety of nerve endings that react to heat and cold, touch, pressure, vibration, and tissue injury. So it produces different type of sensation. It also responsible for heat regulation. So skin contain a blood supply for greater than its requirement, which allows precise control of energy loss by radiation, uh, convection, and conduction. Secondly is control of evaporation. So the skin provides a relatively dry and semi-impermeable membrane to blood loss. So it acts uh, by controlling of evaporation, storage, and synthesis. So it also acts as a storage center for lipid and water excretion. So sweat contains urea, however, it contains very little in amount, but hence excretion by sweating is at most of the secondary function to temperature regulation. So it also regulates the temperature why excrete sweat. Absorption, the cells comprising the outermost layer that 0.25 to 0.4 millimeter of the skin uh, supplied by external oxygen. Also, contribution to the total aspiration is negligible, but medicine can be administered through the skin, like ointment and other topical agent can be absorbed through the skin. It also produce a water resistance action, so skin act as a water resistance barrier to essential nutrient. Furthermore, the classification of we are discussing about topical agents. So topical agent composed of protective and antimicrobial. So we know the protectives are the substance that usually applied to the area of skin that are subject to constant irritation, or areas that have already become irritated or inflamed due to moisture and friction. So the protective work why reduce these type of irritations. So the main properties of protective include they must be insoluble to limit absorption of compound through skin, make it difficult to wash them off, and reduces metallic properties on tissue. So these are the specific criteria of protective. They must be chemically inert to prevent interaction between the protective substance and tissue. So these protective agents should be inert and does not react with the tissue. And protectives generally applied as dusting powder, suspension, ointment. So these are the generally different form of protectives in which form we applied on the skin. Further antimicrobial. We are further more discussing about astringent. Then we already discussed that these agents applied locally and gives protein precipitation action, and they are responsible for cause of contraction and wrinkling of tissue. So they reduce the cell permeability. So what is the work of astringent? They reduce the cell permeability by contracting the local blood vessels. So they inhibit the transcapillary movement of plasma proteins. If we are discussing about different type of astringent, then they may be vegetable astringents like tannic acid, gallic acid, metallic astringent having different aluminum salts and aluminum chloride, aluminum acetate, some zinc salts like zinc chloride, zinc sulfate, ferric chloride, strontium chloride, silver nitrate, copper sulfate. These all are metallic astringent and generally uses as topically. Some miscellaneous agents are also used, very cold water and alcohol. So this is the process how astringent action produce, how the contraction of blood vessels they generally produce in the local tissue. So This is the mechanism of protein precipitation. You can see through this figure that skin that composed of liver and lipid and protein, and these protein contain different peptides, and how atoms which are capable to form metallic bond and form chelation of metal with protein. So you can see here the protein, the thionyl group and amine group, how they form bond with different metals. And astringent have different application. It produce anti-inflammatory action, decrease blood loss, antiperspirant action, antimicrobial action. So further, if we discussing about characteristic of exchangent, then they affect only the superficial layer. So they just protect the upper layer and the reduce cellular permeability. So make the surface mechanically strong. Though, so they make surface mechanically strong, decrease exudation, and they protect from external irritation. So these all are characteristic of astringents. Indication, so generally they are given in swallowed, inflamed or leaky tissues. They are used to treat diarrhea or dysentery. During leukorrhea, they are also used in which the thick white yellowish vaginal discharge occurs. During minor bleeding like menorrhagia, hemorrhoids, they are also used. They promote healing process. So they also responsible for the healing process of the outer surface. They decrease sweating and possesses deodorant properties. So they also decrease the sweating action because they reduce the permeability of upper surface. Mild astringent solution are used in relief of such minor skin irritations as those resulting from superficial cuts, allergies, insect bite. So they also produce astringent oxygen when these process occurs. Uses, so they reduce pain, arrest hemorrhages, promote healing of wound, reduce sweating, and various agents which include under astringent action, zinc oxide, zinc sulfate, calamine, zinc chloride, aluminum sulfate, aluminum chloride, and alum. So first of all, we discuss about zinc sulfate. So its molecular formula is Zn-SO4, and it is generally found in hydrated form. So zinc sulfate monohydrate, which molecular weight is 179.47 gram per mole. Zinc sulfate heptahydrate Zn-SO4 7H2O, which molecular weight is 287.53 gram per mole, and it is also known as white vitriol. And the heptahydrated form generally presents in major amount. So as a mineral, Zn-SO4 7H2O, that is goslerite, that is present generally in nature. So if we discussing about properties, so zinc sulfate is white powder or white granular in nature. It is odorless, astringent and metallic test. Uh, Anhydrous zinc sulfate having density 3.54, but its heptahydrate form having density 2.073. Melting point 680 degree, and it decomposes into anhydrous zinc sulfate that having melting point 1000 degree, and its heptahydrate form having 70 degree centigrade melting point. It is soluble in water, and its refractive index is 1.658 of zinc sulfate, and its heptahydrate form having refractive index of 1.4357. Zinc sulfate, when react with barium chloride, it form barium sulfate and zinc chloride. So it is the reaction with barium chloride of zinc sulfate, and zinc sulfate further decomposes into sulfur dioxide and zinc oxide. So zinc oxide fume that produce, and these both zinc oxide and sulfur dioxide produce hazardous effects. Dehydration of zinc sulfate heptahydrate. So the zinc sulfate heptahydrate dehydrated into zinc sulfate dihydrate at 50 degrees centigrade, and this further uh, dehydrated on 100 degrees centigrade into zinc sulfate monohydrate form, and this monohydrate form further dehydrated at 450 degrees centigrade into zinc sulfate, and further at 740 degrees centigrade into SO2 and zinc oxide. So this is uh, the different dehydration process, how zinc sulfate heptahydrate is dehydrated. It is reported to form double salt with potassium and ammonium sulfate. So zinc sulfate react with ammonium sulfate and form double salt. What is the double salt? Means both salt present in a mixture, zinc sulfate and ammonium sulfate present in a mixture. And zinc sulfate, when react with sodium hydroxide, is formed zinc hydroxide and NaCl. And this zinc hydroxide further reacted with sodium hydroxide produce sodium zincate, Na2ZnO2 and water. So this is the preparation of zinc sulfate. So how can we prepare the zinc sulfate? So zinc, when reacted with H2SO4 and water, it forms zinc sulfate heptahydrate would form with the release of hydrogen. And further zinc oxide, zinc sulfate can be prepared by zinc oxide with the reaction of sulfuric acid in the presence of water, and zinc sulfate also produced by the reaction of zinc sulfide with oxygen. It is used medicinally. It is used together with oral rehydration therapy and as an astringent. So its main action is a astringent. Zinc sulfate is an inorganic compound and dietary supplement also. 0.25% zinc sulfate used for ophthalmic purposes. Zinc sulfate acts as emetic, and it is used as in electrolytes for zinc plating, as a mordant in dyeing, as a perspective to skin and leather. So I have completed my inorganic topic that is related to poison, antidotes, and astringent. Uh, Now I hand over uh, the next presentation to Ms. Simran Preet Kaur, that is Assistant Professor in IPS College. So please start.
Good morning, everyone. I am Simranpreet Kaur, working as assistant professor in ISF College of Pharmacy. So today I will be discussing with you the second module of pharmaceutical analysis, that is acid-base titrations and non-aqueous titrations. Okay. So what is the scope of this unit? This particular module deals with the analysis, preparation,